Good evening, friends. See, today I want to discuss something. After I speak, probably you all can give a thought to this, which is very, very important regarding medical education, the present scenario, COVID scenario. It has been there all along in our country. First, one is based on the caste system, which I don't want to comment, whatever. Reservations. See, what I feel is beyond a certain point, that is, say, 10th, you give all the reservations to everyone. Chance should be given. After that, it should be on merit, especially when it comes to professional courses, more specifically when it comes to medicine. Because medicine, you're dealing with human lives. That is the reason, one of the reasons for brain drain from our country. People get frustrated, people who are brilliant, intelligent, don't get their seats and then they disappear. They go off, settle abroad, do well, and then we find in the papers American Indian doing well, so well. American Indian has treated, Tiger Woods. Why? One, because they don't get chance. Once they go there, they find that they are doing so very well, and of course they are earning better, naturally. So it's human nature to go away. One thing, the present COVID scenario. So I'd like to point out this is of utmost importance here because we find that the students going to appear for the MBBS examination as of now, they've all been on leave. They've been only taught online. They've been taught practical medicine online. In the sense that I'll give you an example. Suppose I've got a heart problem. There's something called as a murmur, which is a sound where the blood passes through a narrowed, a valve or something. That sound you have to hear to remember and then study the pathophysiology behind this and the complications to understand the disease. I hope I'm making it clear. Or I'll put it very simply. Suppose there is a case of tuberculosis. How do you make out? There is a cavity. Cavity means that that area is devoid of the, lung tissue. So when you hear a breathing called bronchial breathing. That will be like blowing through a pipe. That has to be heard to understand, remember, then make a diagnosis. Unless you hear all this, you see patients, examine patients, first get the history. History means he is telling his story, he is giving you the diagnosis. This is how we were taught. Fascinating medicine is. When you're talking to the patients, people will say, why this fellow is keeping on talking, doctors are keeping on talking. They are getting the diagnosis right away. That is the way. Then when you put your stethoscope and other things examined, by the time, a really good doctor should have come to a diagnosis. And all the tests in most cases are to confirm this diagnosis. And also for legal other purposes and also for the patients to understand that they've really got the problem. But here what happens, we have got students coming in this month. There is 1 month and I've not seen any patient at all, even a fever patient, and taking up an MBBS examination. Is there any sense in this? Because imagine that somehow they have passed. I am not blaming the students for this, please, because there is a tendency to blame COVID for everything. It is not the fault of the students. There's no point in telling you are idiots and all that because they are reading theory. See, medicine is studied as a science and practiced as an art. And this involves human lives. Unfortunately, for many people, it cannot be made into a business. It is a life saving art which is sacred. So, there again, there's a lot of corruption, other things which is going on. Not everyone, but it is still there as in any other field. But that is besides the point. If you want to improve the quality of medical treatment in the country, you should first look at the quality of doctors coming outside. When some college says that you have got given 100% results, 100% results, if I were in the board evaluating these colleges, I will say that this college should be in the last. Because when you really evaluate, if you had looked at colleges like Stanley Medical, I won't even say Madras Medical College, because especially for the postgraduates, the percentage of results is still around 60-70%. Stanley standards are maintained, especially at postgraduate levels. Unless you are really good, you cannot go out. Of course, one cannot know everything. You learn by experience. Take CMC Vellore, All India Institute of Medical Sciences. It has to be that way. So, college which is giving a lower percentage, especially at postgraduate level, you have an eye on that, you know that college should be good. Not a college just like that, especially in the present scenario when it is so sad that students are not examined even a case of fever. What do they do when they go out? Study during house urgency? No chance. Because unless you have this thing, fear that you have to pass an exam, you study. Otherwise, you tend to, at that age, relax and enjoy. And then take life as it comes. This is not done. So I feel that it is time that the government takes a very serious view on this, postpone the MBBS exams, postpone the present exams, see that patients are there for students to, study the patients, examine the patient, then learn and then appear for the exams. Not just like that appear for the exams without having, that is on imagination basis going around. They may still get a pass. This is not correct. This is not correct in various points. One, public, danger for the public. Second, the doctors who come like this, their lives are in danger. Because what do they do when they come out? They don't know anything. They can just be probably like compounders of yesteryears and then carry on with other doctors. They will be treated at ground level when they go as a duty doctor outside. They will be never given any respect. They won't know. How can they study the whole medicine when the exams are over, they have passed? We put high standards for students coming from Russia, Philippines and other those things. I have seen so many of the younger doctors struggling 8 years, not past that. Indian exams are so tough. Even MRCP from the US is still, it is under debate whether to recognize or not. Definitely it should be like that. Because the diseases present in our country are totally different. A student coming from Russia will not know much about tropical diseases. If you have to practice here, you have to know about those. So these are complex situations. But one thing for sure, a student who has not seen any cases taking up practical medicine examination, the whole thing is a farce. The government has got to do something about it. So it's very, very important because the exams are there, going to be there in April, and the students, I know in most colleges, because of COVID, they were not in the hospital at all, not seen any patients, not seen, just like that blinking, going for the exams. And of course, various ways of passing are there. They might get through happy, and then what happens? Their lives are in a quandary, as well as the public, they don't know. They go by the external appearance, the way a doctor puts forth, and your physical body language, whatever. That is not done. It is what is here. And practice of medicine is not easy. Making a diagnosis is not easy. That is where providence comes from. If you learn too much, you can only confuse yourself. And to get to a correct diagnosis in any situation, the thought, the clarity is given by God. That is what comes in the physician's prayer. Very, very important. If you don't believe in God, in a higher power, some power is there, which helps a doctor to make a proper diagnosis. Or at least tell him he is wrong. The conscience will tell, I don't know, I am wrong. At that time, you should be humble enough to refer, accept it, because no one knows everything. That's very, very important. I'm sure that the government should, if this is brought to their notice, will take some, give this some importance and probably postpone the exams, ensure that they are seeing patients, especially important common cases, understand, study, and then take up the exams. Please. Like just like that, giving pass for 10th up to 12th is not done in the medical field. It is almost going to be like that now. So for whatever reasons, political reasons, citing COVID, you give passes for everyone. Where is this thing of merit gone? So this is really frustrating from a doctor's point of view, from a teacher's point of view. When I look from a public point of view, from a generalized point of view also, it is not right. It's not done. The Prime Minister trying to bring in Harvard standards here. Let us, wonderful, fine, but let us at least reach our own top university standards, Stanley, CMC Vellore, AIMS standards. Let us reach that and then think beyond. For that, many heads are required, not just one or two, without bias. These should be thought over and then decided, not just like that overnight. Please give this a thought, my dear friends. Very, very important. Because you might end up being a patient, already seeing a lot of issues around. You don't want this to happen. Doctors might get into trouble, these doctors, legal issues. They might lose their license. So many things they have also got, but they don't know, they're young. They just want to get a pass and go. If I were in their position, I would want to do that. But being in a mature position, I'm able to think this way for them also. So please take a broad view of this. I don't know where this is going to reach. I hope it reaches the right people and they take the right decisions at the right time and then clear this. This should not be happening, and then try to improve the standard of the medical education so that the next batch from this thing, next generation, we get better doctors to treat our countrymen in a better way, so that we are doing very well in the medical field now. Let this start from the ground level. It is a must, it has to happen. Thank you so much, dear friends.